Okay, so let's move into the medical. When you're manufacturing medical components, you have to have cybersecurity there. So if you guys can speak to these questions. So what unique cybersecurity risks do engineers face when they are designing medical devices? And how do you secure a medical device?
Certainly patient safety risks, right? I mean, there is a heightened level of security that you need for any type of device that can potentially manipulate device settings, functionality, cause harm to patients. For example, altering the dosage in an insulin pump, right? We saw that in an attack a few years ago. Data breaches and privacy violations. So, now you're starting to bring in obviously PHI, and compromised devices can violate regulations like HIPAA. So the challenge is ensuring that all patient data handled by the device is encrypted and secured, whether it's stored on the device or transmitted over networks. Um, and then the other, as Gonda mentioned with manufacturing, is you still have the legacy problem. You have all of this legacy equipment in hospitals and other centers where you want to now suddenly connect them. How do you retrofit cybersecurity, identity access management into that space to bring a common baseline? And then I would say, what we're seeing increasingly with IMOT is these can often be lower cost, low power, low storage type devices. And so that introduces new cybersecurity implementation challenges, right? So when you talk about encryption, you want to be able to do it at the strongest levels. And can the device support computation at that level, right? So there's really an interesting set of challenges as you go smaller and smaller with IoT as well, and more commodity.
Well, definitely the personal safety aspect. So, of course, industrial devices are typically part of critical infrastructure, but separate classes of devices, I would say medical or automotive, of course, always also implicate the safety of an individual if something were to go wrong. And that's where you also typically see more stringent market access requirements, both in the US or in the EU and also globally. So the uniqueness is really that imminent safety risk to an individual. And then, yeah, again, requirements have been evolving quite quickly. So in terms of how regulated is medical device security now versus industrial device security or device security in general, it's definitely among the more regulated spaces. So in the US, to pay attention to specific guidance from the FDA, the regulator, especially since the updated guidance of last September 2023. And in the EU, the role that is played by the medical device regulation. And again, roles of industry standards, luckily not that many different standards. Again, IEC 62443 is a key standard, is important. So I would say the combination of the personal safety and then also how regulated the space is, both to get access to the market and then actually, if you look at the FDA guidance, there's very stringent post-market surveillance requirements as well. So that really propels the need for ongoing monitoring of device security also as part of deployed environments. And as a manufacturer or as an engineer designing these devices, making sure that you have an ability to continuously monitor the security of the software of the overall device and do updates as is needed, and also basically be able to document that as part of a up-to-date paper trail with risk analysis and threat modeling.
So you mentioned the new regulations require built-in cybersecurity and ongoing security monitoring and updates. So how do these regulatory requirements shape the cybersecurity strategies for these medical component designs?
Well, definitely, in as far as I've been working with medical device manufacturers as well, to basically get market access in the US, that means you got to go through the FDA process. It means that you need to provide more information, for one, about all of the security controls implemented in your device. And as an example, I mentioned earlier the software bills of materials that is currently a very specific requirement in the pre-market guidance that you have a up-to-date and accurate and complete software bills of materials, meaning that you have that description of all of the software components in the device. Definitely, among others, implies that you have more of these artifacts like a risk analysis, a threat model, an SBOM that you can submit with your other information to the FDA as a regulator to get access to the market.
Yeah, so I think what's interesting there in terms of how it's driving the medical device manufacturing market is certainly it's security by design. There are also, I think, elements of now these devices, when you talk about having to support strong encryption, have to really reevaluate what their authentication identity strategies are, right? And there's, when you look at some of the certifications like high trust, they now are talking about using mutual TLS for actually pinning communication to specific devices and not just, relying on sort of standard web-based TLS as a kind of understanding that this is more sensitive data and more sensitive communication link, which is great to see. And it's really starting to impact the early design of some of these identity access management measures into these devices. And then also there is, interestingly, as it's, these devices are increasingly becoming networked and being integrated into networks, there is increasingly a necessity to integrate at a network level with other pieces of applications, software, logging, monitoring, and making sure that you are compliant and easy to integrate, right? Even if it is, okay, I need to emit my logs in a particular format so that it is ingestible by a security event management system like a Splunk or an Elk or something like that. So it's nice to see that they are being designed with a lot of those concerns in mind, including patching, encryption, all of that Gonda has mentioned.